Natural situation E. Number 1. The answer that I have for question number 1 is the two technologies that I have chosen are fertility treatments and embryo adoption. Fertility treatments can be used in this situation because she is infertile. This might help her be able to eventually have children on her own and hopefully be able to carry a child the whole time that needs to be carried in a pregnancy. This could also help with making it easier for the sperm to fertilize and egg, make it so it would help the uterine lining. Embryo adoption could also be used in this situation because even though they are not embryos from Lindsay, could still help her providing a kid in the future. This is because she will have be given an embryo, which will lead up to her carrying a kid. Number 2. Fertility treatment typically refers to medications that stimulate egg or sperm production, or procedures that involve handling eggs, sperm, or embryos. Even though infertility goes beyond fertility treatments, it can also include surgical treatments, lifestyle changes, weight loss, or treatment of an underlying medical condition. Your infertility treatments will depend on the cause or causes, whether it's male, female, or both. The problem remains unexplained. The good thing about this treatment is that almost 85 to 90% of people that are dealing with infertility are treated with low-tech treatments, such as medication or surgery, and less than 5% of people associated with reproductive technologies. Out of the people that receive fertility treatments, just under half will end up having a baby. 3. All of the following could be risky when you're considering fertile treatment. Age. The quality and quantity of a woman's eggs begin to decline and increase with age. Smoking. Besides damaging your cervix and fallopian tubes, smoking increases your risk of miscarriage and ectopic pregnancy. Weight, sexual history, and alcohol. 4. Researchers in Italy transferred so-called mosaic embryos characterized by irregular numbers or arrangements in chromosomes in some cells into 18 women during IVF procedures. All 6 full-term pregnancies that followed resulted in chromosomally normally infants, and researchers reported diagnosed during a special type of biopsy during IVF. Mosaic embryos are not typically chosen for transfer in the United States because of the potential to develop into babies with genetic disorders. The Italian researchers were able to generate some normal pregnancies, even though most of us in the field probably wouldn't have jumped up and down to use embryos like that, Dr. Ronald Forberg said. For reproductive endocrinologist and fertility specialist with Christina Healthcare System in Willington, Dell. The quid has lots of different patterns on it, and that is why we potentially think that is going on some embryos, explained Forberg, also director of IVF programs at Reproductive Associates of Delaware. That doesn't mean the quid is not functioning or working well. The biological processes in embryos that we don't fully understand. Scientists are unsure how common mosaic embryos are, but agree the prevalence tends to increase with women's age. Between 10 and 20% of women's eggs might be chromosomally abnormal in her mid-20s. That proportion increases about 90% by age 40, Forberg said. But the mere presence of the chromosomal abnormalities in an egg or embryo doesn't always lead to detectable health condition or resulting in fetus, he said. Researchers from the European Hospital in Rome detected chromosomal magnetism in 5% of about 38,000 embryos. Included in the study, they offer to transfer mosaic embryos into 18 women for whom IVF hadn't previously worked. I also believe that life starts when you first find out that you're pregnant, and yeah, that's the